Start with viral gastroenteritis, which is the chapter 44 of your Apurba Sastry Essentials of Microbiology. In this chapter, we'll be covering rotavirus diarrhea and other viral agents of gastroenteritis. The viral etiology accounts for majority of acute infections gastroenteritis worldwide. Viral gastroenteritis is most commonly occurs among children. However, persons of all ages can be affected. Several enteric viruses can cause acute gastroenteritis in humans, most common being the rotavirus. Rotavirus diarrhea. Rotavirus are most common cause of diarrheal illness in children. Morphology: rotavirus measures 60 to 80 nm in size and possess icosahedral symmetry. Comprise of a triple layered wheel shaped capsid, rota in Latin meaning wheel. Possess segmented dsRNA 11 segments. Proteins: there are 6 structural viral proteins VP1 to VP7 except VP5 and 6 non-structural proteins NSP1 to 6. VP6 viral protein 6 is group specific. Virus causing gastroenteritis. Rotavirus genome is segmented double stranded RNA and it causes group A, most common cause of severe endemic diarrheal illness in children worldwide, and group B causes outbreak of diarrhea in adults and in China. Calcivirus, and then it includes norovirus, which has ssRNA, cause outbreaks of vomiting and diarrheal illness in all ages, especially in older children and adults. And sapovirus, which also has ssRNA, it causes sporadic cases and occasional outbreaks of diarrheal illness in infants, young children, and in elderly. Astrovirus also has ssRNA. It also causes sporadic case and occasional outbreaks of diarrheal illness in infants and young children and in elderly. And last, adenovirus, it's the most severe form, type 40 and 41. It has double-stranded DNA, second most common viral agents of endemic diarrheal illness of infants and young children worldwide. Okay, so now we come to the classification. Before that, VP7 forms the outer capsid layer and VP4 forms the spikes that emanate through the outer capsid layer, are strong inducers of neutralizing antibodies and are type specific. Now coming on to the classification of rotaviruses. Rotaviruses belong to the family Reoviridae, the only virus family to have dsRNA. Traditional groups: rotavirus are further classified into 7 major groups A to G based on antigenic composition of the group specific VP6. Most human diarrhea is caused by group A. Binary system of typing is the recent classification of rotavirus, which is based on a binary system, that is combination of both serotyping and genotyping methods. Genotyping method is based on the gene coding for VP4 antigen, a protease sensitive protein or P-type antigen. Genotype numbers are expressed as P1, P2, etc. Serotyping method is based on VP7 antigen, a glycoprotein or G-type antigen. Serotype numbers are expressed as G1, G2, etc. Currently, 19G and 28P types are known. The most common type seen in the world as well as India is G1P8 type, which accounts for nearly 70% of total isolates. So the diversity among the rotavirus types is most commonly encountered in areas with poor hygiene. Pathogenesis: rotavirus are transmitted by fecal-oral route, then progress further to destroy enterocytes of the small intestine. However, the gastric and colonic mucosa are spared. They multiply in the cytoplasm of enterocytes and damage their transport mechanisms, resulting in secretory diarrhea. The non-structural protein NSP4 acts as enterotoxin and induces secretion by altering epithelial cell function and permeability. Clinical manifestations: the incubation period is about 1 to 3 days. It has an abrupt onset characterized by vomiting followed by watery diarrhea, fever, and abdominal pain. Recovery usually occurs in majority, but a few children may suffer from severe loss of electrolytes and fluids leading to dehydration. Infected adults are usually asymptomatic but show seroconversion. However, epidemics for large outbreaks have occurred in adults, especially in closed populations, example geriatric ward. Group B rotaviruses have been implicated in large outbreaks of severe gastroenteritis in adults in China. Epidemiology: rotavirus are the single most important cause of gastroenteritis in young children. Worldwide, about 3 to 5 billion diarrheal episodes in children occur annually, resulting in nearly 1 million deaths, especially from sub-Saharan Africa and Southern Asia. In developing countries like India, rotavirus illness occurs at a younger age. It is less seasonal and more frequently caused by diverse uncommon serotypes. whereas in temperate climate, group A rotavirus cause outbreaks in cooler months. Rotaviruses cause 8,72,000 hospitalizations and 32,70,000 outpatient visits and estimated 78,000 deaths annually in India. Lab diagnosis. Direct detection of the virus feces collected early in the illness is the most ideal specimen. Rotavirus can be demonstrated in stool by immunoelectron microscopy IEM. Rotavirus have a sharp-edged triple-shelled capsid, look like spokes grouped around the hub of a wheel. Isolation of rotavirus is difficult. Rolling off tissue cultures may be attempted to enhance replication. In this figure, we can see the rotavirus electron micrograph, which shows a wheel-like appearance. Detection of viral antigen in stool by ELISA and latex agglutination based methods. RT-PCR is the most sensitive detection method for detection of rotavirus from stool. Typing methods G serotype and B genotypes of rotavirus can be detected by RNA sequence typing and neutralization test respectively. Serologic test ELISA can be used to detect the rise of antibody titer. This may be useful for seroprevalence purpose. Treatment is mainly supportive to correct the loss of water and electrolytes such as oral or parenteral fluid replacement. Prevention. Vaccine. Two brands of rotavirus vaccine are available. Rotavac. It contains live attenuated rotavirus 116E G9P10 strain. It provides cross protection against many types including G1P8 type. It is manufactured by Bharat Biotech India. It is introduced under National Immunization Schedule of India 2020 in selected states Andhra Pradesh, Assam, Haryana, Himachal Pradesh, Jharkhand, Madhya Pradesh, Odisha, Rajasthan, Tamil Nadu, Tripura and Uttar Pradesh. 3 doses, 5 drops per dose, are administered orally at 6, 10 and 14 weeks along with DPT and OPV. Overall efficacy in first 2 years of life is about 55%. Side effects more than equal to 5%, crying, irritability, fever and diarrhea. No vaccine induced intussusception has been reported. Rotarix. Rotarix contain live attenuated G1P8 strain. It also provides cross protection against G3, G4 and G9. It has to be reconstituted before use, given as 2 doses, first at 6 weeks and second dose given at 4 weeks later. General preventive measures include measures to improve hygiene and sanitation in the community and contact precautions such as strict hand hygiene to prevent transmission from infected persons. Now, the other agents of gastroenteritis. Family Calciviridae comprise of 4 genera, out of which 2 consist of important agents of human diarrhea. Genus Norovirus, which includes the Norwalk virus, and genus Sapovirus, which includes Sapporo-like viruses. They are icosahedral, 27 to 40 nm in size, possess cup-like depressions, calyx meaning cup, on the cap's surface, typically observed under electron microscope. They are single-stranded, positive sense RNA and a single major structural protein. Norwalk virus is the most important cause of epidemic viral gastroenteritis in adults. It is common in winter months in temperate climates, therefore called as winter vomiting disease or gastric flu. Symptoms begin 12 to 48 hours after the exposure, characterized by diarrhea, abdominal pain, nausea and vomiting. Common food sources include contaminated salad, fresh fruits, shellfish such as oysters or water. Other sources include infected person touching contaminated surfaces. Sapovirus causes sporadic cases and occasional outbreaks of diarrheal illness in infants, young children and the elderly. Laboratory diagnosis and treatment are similar to that of rotavirus. They are not cultivable. Adenovirus type 40 and 41 are the second most common viral agents of endemic diarrheal illness of infants and young children worldwide, responsible for 2 to 12% of all diarrhea episodes in young children. Astrovirus exhibit a distinctive star-like morphology under the electron microscope. They are of 28 to 30 nm size with an icosahedral symmetry and contain a positive sense ssRNA. At least 7 serotypes have been identified, of which serotype 1 is the most common. Astroviruses cause sporadic cases and occasional outbreaks of diarrhea in infants, young children and elderly. Respiratory viruses, diarrhea has also been reported as a part of manifestation of certain respiratory viruses such as SARS coronavirus, influenza A H5N1 virus, influenza A H1N1 virus, the 2009 pandemic strain. Toroviruses and Ticobinaviruses cause gastroenteritis in a variety of animals, but their role as primary cause of gastroenteritis in humans remains unclear. Okay, so this completes our chapter. Now the expected questions. Short note on rotavirus gastroenteritis, we can write MCQs. The most common viral gastroenteritis is caused by the rotavirus, which is the most important cause of epidemic viral gastroenteritis in adults. It is the Norwalk virus. A 6-month child presented with diarrhea and vomiting in 3 days. Which of the following enterotoxin is most likely responsible for the condition? It is the NSP4. And the most common organism causing diarrhea in adults associated with shellfish ingestion is the Norwalk virus. Okay, and the rotavirus vaccine given by which route? It's given by the oral route. Okay, so this completes our chapter. Next, we'll be starting with protozoan infections. Okay, like, share, subscribe. Thanks for watching.